Okay, thank you. Yes. Well, I'd like to take a moment as well to introduce Dr. Simone. Simone came to Little Rivers after completing her residency at Providence Milwaukee Hospital in Portland, Oregon, where she was chief resident. She and her husband were eager to come back east to raise their son, Benny, at the time. And Simone did her training in inner city Brooklyn. And she's passionate about her care for working with the most vulnerable and in need. She enjoys working at Little Rivers with a medical home philosophy and in a community-focused environment where she can also practice obstetrics. So some major accomplishments have occurred at Little Rivers, similarly to the transformations I think that the chambers had this year with just a change of focus due to the pandemic and the new leadership with Ruth Ann. Little Rivers over the last several years has really grown and grown a lot from the contributions specifically from Simone. In 2019, Simone was a Bi-State Primary Care Association Vermont Outstanding Clinician. She has made major differences within Little Rivers that bring changes for our patients and significantly in the electronic health record system that improves the quality of our care and of course the organization of everyone's health records. And that included bringing that on board at Little Rivers, being significantly involved in bringing it on board. And in the last couple of years, moving that resource from right at Little Rivers to the cloud in a more secure and structured environment. Simone was pivotal in the early development and expansion of our medication-assisted treatment program, originally in Wells River, and now, again, due a lot to her leadership and those on the MAT team, providing services at all 3 of our clinics. And she's been had a significant role in the development of our behavioral health program, which has miraculously grown the number of behavioral health providers to equal the number of primary care providers, providing integrated care in all of our clinics and 6 local schools. Since among all of these developments, Simone also built a home and had 2 family additions of her daughter Soso and son Noah most recently. She is our chief medical officer. She serves on a local school board of directors, and the biggest change, which I think it's felt really refreshing at the chamber, again to have Ruth Ann here. She's a big asset and brings a spirit that will really guide us as we move forward out of these tough times. And similarly with Simone at Little Rivers, we have a culture of caring and engagement. And I've never met anyone more on task with caring about people and being focused and task oriented. She has the unique blend of getting things done, but not overlooking people being human and their needs. So lastly, before turning over to Simone, I think she might be about to right now too, so she could be really tired, I'm not sure, but I know at the beginning of this year, she delivered the first baby at NBRH in 2021, and she's always on call and running at the hospital. So welcome, Simone, and I'll turn it over to you.
Now I have to look at myself really big. Hi, everyone. Thank you, Andy, for the introduction. So yes, I'm Simone, Dr. Simone commonly called. And obviously I was a choice to speak to you all tonight because of what we've all been going through for the last almost year now. I remember when school shut down mid-March last year pretty vividly, having two school-age kids right now, and we're not so far off from March right now, and that's pretty shocking to me. And as you guys have mentioned already, this pandemic has led to a lot of changes, both for businesses as well as for communities, as well as for individuals. And it sounds like the Chamber has had a similar experience to Little Rivers, which is shocking to me how much we've grown this year, and had some very serious undertakings that the community was just right on top of supporting and making sure that despite all of the struggles we're going through right now, it's not just our community or our country, but it's really global that we're struggling with COVID. But I've never seen such support and communities coming together like this before. As soon as the pandemic started, the Wells River Savings Bank reached out, and they have been supporting us with food, which everybody knows is the immediate way to anyone's heart since the beginning of the pandemic, and we've appreciated it to no end. And just little things like that have meant a lot in the communities. And when everything shut down, people were afraid for their relatives, their patients, their friends. Businesses were terrified, especially in rural communities like ours, of how they were going to survive, if they were going to survive, or if everything would become either a Walmart, and that would be their opportunity to come in, or we just wouldn't have functioning businesses in our communities. And it's been really overwhelming to see that that's not been the case. Businesses are continuing to thrive, are continuing to operate with all of the safety measures in place to make people feel comfortable going into them. And that's really reassuring. So seeing that is pretty wonderful. The other interesting thing, and you've talked a lot about the workforce development projects that the Chamber is undertaking. I was interestingly selling a house last summer. Andy mentioned that we just built a house. So I was selling my last house and saw the influx of flatlanders, of which I am admittedly one, but coming into the area, buying houses, coming from Boston, coming from New York to escape COVID and get out of that, and seeing all of these people come into the area. My first response, of course, was, don't come here. We're trying to keep our area safe. Let's not have this influx. But as we've settled into it, it's really changed a lot of talent that different businesses have access to. We've experienced that. And it's also just lent a different culture to a lot of the communities, with so many people coming and joining our small towns. So that, I feel, has been really interesting to see during COVID. And, despite our fears, I feel like most people have felt really welcomed here. Despite their Massachusetts license plates that probably scare people at the gas station. One really interesting, this was astounding to me, but as Andy mentioned, our behavioral health program has grown by leaps and bounds over the last 5 years. When I joined Little Rivers, we had 2 counselors, and we now have 12. So we had hired a new counselor who joined us, and because it's COVID, we never actually met in person. We had done Zoom interviews. And several weeks, a couple months after she had joined, we're on a Zoom meeting, a provider meeting, and she noticed my name across the bottom, and she saw my face, and I get a text later that day from my mom in New York City. And she said, "Did you hire Caroline?" And I said, yes. How do you know that? My mother is a social worker in New York City. She used to work with our new counselor, and I had no idea until this woman recognized my name and my face on a Zoom meeting. So, it was amazing to see these small worlds coming together because of COVID. She left New York because of COVID, and ended up here with me, a coworker's daughter. So I just found that very cool. That a place like Wells River could attract people from all over the world, I find wonderful. So, of course, we welcome new talent coming into the area, new blood for our communities. But the other thing that we never forget is everybody who is born and raised here, multiple generations in the area, the people who make this area what it is, and wanting to support them and wanting to have the talent here to support our businesses and support our organizations. So I know that Riverbend is a big focus of the chamber, and has also done a lot of work with Little Rivers. And we definitely want to support all of the people who grow up here, and finding opportunities for education and ways in Little Rivers to support people who are continuing their education while still working with us has been a big push, and Andy has been a big part of that as well, to explore that, because as sparkly as new people can be, it's the people who have been here and continue to be here that are really holding the community together, and we always want to support that. So that's just a little bit about my take on the folks that have changed and shifted during the pandemic. I know that this summer things were looking a lot better in our area. We thought we had sort of skirted the main thrust of the pandemic, and we're feeling pretty good. And then the fall hit, and we realized we are not immune, and we sort of let our guard down, and now we really need to step it back up. And I know that working with the state, they've been doing everything they can to encourage people to be smart, make good choices, and avoid groups and travel. And we have largely remained one of the safer places in the country, which is amazing. And I'm so proud of our community for being able to do that. Did not dampen my excitement when vaccine became available. And I really see that as the light at the end of the tunnel for this whole year. So a lot of us at Little Rivers have been lucky enough to be vaccinated already, working in healthcare. And now we are doing our best to support the state as they roll out vaccine to everybody else. And there was some conversation when I first signed on about who that is and how that's going to happen. And, unfortunately, we don't yet have vaccine at our clinics to be able to directly offer to patients, but we're hoping to support the state however we can. And, I really am looking forward to this summer, and hopefully, at least Dr. Fauci says, by the fall, life will have some semblance of normalcy, or pre-COVID normalcy, whatever that may be. So I'm looking forward to that, and looking forward to being able to visit all of the businesses in our towns that I haven't visited this year, and taking advantage of all of the variety of talent and skills and interests that our community is so full of. So, I definitely see that light at the end of the tunnel. And I definitely, not to politicize anything, but I'm very excited for tomorrow and hoping for some shifts in planning around vaccine distribution and getting things out there so that our communities can be as vibrant as they were before last March. And I'm looking forward to how that's going to happen. And I know that everybody here, and certainly everybody at Little Rivers, is looking forward to supporting that. So that's really all. If I'm happy to take questions, I imagine there are some about vaccines, but anything about Little Rivers or healthcare?
If anyone has a question for Dr. Simone, if you unmute yourself, that'll be a signal and I can call your name if there's more than one person. Okay. Looks like first up is Paul Hunt.
Yes, and I don't know whether this is a question for Dr. Simone or more for Sarah Copeland-Hansis, but is there anything to be done about certain local businesses who are not respecting the mask mandate whatsoever?
Legally or not? I mean, you know,
there's one business that I know, and I don't see the point in naming it here, but
no, of course not.
they had a 25 people within their space the other night, and a full third of them were unmasked, including one of the owners. Is there anything that can be done about that? Is there a place to register a complaint? Is there an enforcement mechanism?
There is not, as far as I'm aware.
I see Sarah raising her hand, though.
Thank you, Paul. I unmuted myself, but it wasn't enough of a signal to to get into the queue. And Simone is correct that there isn't an official enforcement mechanism, but the reason there isn't an official enforcement mechanism is because we have deferred to Governor Scott for leadership on COVID response, and the governor has declined to do anything formal in terms of enforcing a mask mandate. And so, yes, there are places that you can register a complaint, and I would suggest that you do that through the governor's portal on the vermont.gov website. The Agency of Commerce and Community Development is supposed to be the place where businesses get their information around recommendations on masks to continue operations safely during COVID-19. So you might also check the ACCD website and see if they have a portal where you could inquire about a particular business that doesn't seem to be enforcing a mask mandate.
Paul, the Vermont Department of Health, I can send you a link, has a registration. I've used it several times for businesses, and follow-up has happened very quickly, so it does work.
Great, thank you. Jenny Copeland, do you have a question? Jenny?
I think she might have just come in unmuted.
Oh, you're just unmuted. Sorry for calling on you. Does anybody else have any questions for Dr. Simone? We all know everything we need to about vaccines and COVID. I find that hard to believe.
I have a question, Ruth Ann. This is Erin.
Yeah, go ahead, Erin.
Will Little Rivers possibly help disseminate information from the state to our local like social media channels and things, as far as how people will be to go about signing up, or doing the lottery or whatever that is? Throughout the pandemic, they've been really helpful in disseminating numbers and testing sites and things like that kind of information. So I'm just wondering if they might also be willing to do that for the vaccines.
Absolutely, yeah. As soon as we get the information, Andy has been working with Ashleen Buchanan, who's our grant manager, and they've been really good about sending out weekly or more frequent updates. So as soon as we know what the state is doing, we'll put that out there. And we're actually organizing to make individual phone calls to patients if necessary, making sure people are getting signed up, working with the state of New Hampshire to validate people's conditions who need to in order to get the vaccine in that first wave. So we're doing all that work, and we will most definitely be advertising it, yes.
Great, thank you. And if the chamber can help in any way to get out general information through our channels, please let us know as well.
Excellent, thank you.
Any more questions?
Simone, do you happen to know whether anywhere in New Hampshire nearby is going to be doing vaccines?
That's a great question. I don't know where their distribution sites are. No. I know that the closest one in Vermont is St. Johnsbury or White River Junction. I don't know where the New Hampshire sites are now.
Yeah, the New Hampshire sites just haven't been chosen yet.
There you go.
We'll be able to enroll, or at least the beginning steps, by using 211 or by doing it on email starting on Friday at 8 o'clock.
And my understanding is New Hampshire is actually reaching out to many people if they have emails. So we'll be contacting those who are eligible, as opposed to everyone having to contact them, which is not happening in Vermont. But Vermont will be putting out a phone number as well as a website, and 211 is available for that as well.
White House YouTube channel this afternoon. It's a departure from recent presidents. This is where you go. Farewell.
Doug, did you have a question?
I just understand that the armories, the New Hampshire's using armories, Lebanon, I think Littleton. It's online. So I mean, they are vaccinating, there are sites around.
This is the website. Persons, wait a second, I'll show you.
I mean, there's a website, vaccinesnh.gov, and anyone over 65 can apply starting on Friday, which is which is kind of a nice deal if you're over 65, like some of us.
Yeah, Vermont's first wave is those 75 and older, and New Hampshire's first wave is 65 and older, or those 18 to 64 with certain medical conditions, which is what the primary care offices have to validate. So all primary care offices have already been sent that information and are giving those lists back to the state to help them know who to reach out to in New Hampshire.
Dr. Simone, can you just confirm that Vermont is not doing the medical conditions, right? It's just age.
Correct. They're going to vaccinate everyone once they're going to do it in 5-year bands. So 75 plus, then go to 70, 65. And once they hit 65, then they're going to consider medical conditions. Yeah.
Okay. Looks
Well,
like that's
one
it.
more.
Oh, one more. Jump in.
Dr. Simone, so it's up to the individual to get on the website and determine what to do about getting vaccination. I mean, so if you fit into the category of one age group or another, you then reach out and say, here I am.
Yeah, you're talking about Vermont?
Yes.
Yes, so starting on the 25th, so next Monday, that registration will be open for appointments starting on the 27th. So if you're 75 or older, you can register starting on the 25th. They, as far as I know, have not yet released that website on where you would go, but they will release the website as well as the phone number, and then you'll be responsible for calling or logging in to register yourself for an appointment. And 211 is available for help, and at Little River certainly will be, and I'm guessing most primary care offices will also be there to help any patient who needs to get registered.
And in New Hampshire, we would be able to register non-email residents?
Yeah, same in New Hampshire. They'll have a website as well as a phone number, but I believe in New Hampshire, if they have your email, then they will be reaching out to you.
And without, if there's individuals without email?
You can still register.
Right.
They might not reach out to you as quickly. I'm not sure if they're planning to follow up with phone calls for those who didn't register via email.
100 million in 100 days. Let's go.
Didn't quite work out that way.
We don't know that.
Well, that's true. The main holdup, at least in Vermont, is supply. So Vermont is ready to go. I'm assuming New Hampshire is as well. They have the structure in place. They have many people, you know, Little Rivers is chomping at the bit to get vaccine. There's just no vaccine. The state of Vermont gets less than 9,000 doses a week for the entire state. So they're rolling those out as judiciously as they can to get people vaccinated, not to waste any doses, but doing it as quickly as they can. So if more vaccine is available, they'll do it faster, no question.
That's great to hear, Dr. Simone. I'm glad to know that the infrastructure is there nearby, because you hear terrible things.
Yeah.
So I hope that the vaccine will start flowing more quickly.
Indeed.
So I think that's all we have with Dr. Simone. Thank you so much to bring your guidance and your information to us.
Thank you.